What's up, everybody? Saturday. Hopefully you guys have a weekend that's getting off to a great start. Let's get into this. Johns Hopkins professor claims the U.S. will reach herd immunity by April, pointing to a 77% reduction in infections over the past 6 weeks, and slams other experts for hiding the truth. Dr. Marty Makary made the bold claim that the U.S. will be effectively free of the 19 by spring. He estimates that by then, prior infection and vaccinations would bring the U.S. to herd immunity. Dr. Makary noted that daily U.S. infections have fallen more than 70% in 6 weeks. He compared the decline of illnesses to a miracle drug and said public health officials are hiding the promising signs that the pandemic is ending. Why would they hide the signs? I don't know, it's a mystery. These are some pretty bold claims. Let's see what he's got to say here. He made the bold claim we'll have herd immunity by April. Dr. Makary spoke in a Wall Street Journal editorial that he estimates that the U.S. will have herd immunity by then, driven by the high but underestimated number of people who have been infected already and vaccination. Some medical experts privately agreed with my prediction that there may be very little 19 by April, but suggested that I not talk publicly about herd immunity because people might become complacent and fail to take precautions or might decline the vaccine. Said Dr. Makary in his editorial published Friday, but scientists shouldn't try to manipulate the public by hiding the truth. Be great if we had scientists who didn't lie about the science. Dr. Makary noted that new daily infections have declined 77% in the past 6 weeks. A dailymail.com analysis of Johns Hopkins data shows 72% decline, equating this decrease to a miracle pill. Former Vice President Joe Biden also said he hopes Americans can return to normalcy by the end of this year during a visit to a Pfizer vaccine manufacturing facility in Michigan on Friday. The U.S. saw 74,676 new cases on Friday, compared to 6 weeks ago, when the 7-day rolling average of daily new infections was 247,164. Infections have been declining steadily for the past 5 weeks, but top health officials, including Dr. Fauci and CDC Director Dr. Rochelle Walensky, have warned that the progress is tenuous. America is still seeing more new infections a day than it did at the height of the summer peak, Dr. Walensky reiterated Friday. And even the current downward trajectory is threatened by the spread of new variants like the UK's, which has already caused more than 1,600 infections in 43 states. New strain, winter, Dr. Makary's rosy prediction largely dismisses the presence of variants, noting that cases are declining in the UK, where the B117 variant quickly became dominant, triggered massive case surges and lockdowns there. He also claims that herd immunity in the Brazilian city of Manaus, where 76% of the people had already been infected, resulted in a slowing rate of infection. But the Lancet report that he drew those statistics from documented the resurgence of 19 despite high proportions of the population who had previously been infected. In the US, the CDC predicts that the B117 variant will become dominant by March. Cases are already doubling about every 10 days, according to a recent Scripps Research Institute study, and experts are concerned that the 1.5 million doses of vaccine being given a day won't enough to the more infectious variants now spreading in the US. I believe it should say won't be enough. Inevitably, the US and every other nation comes a little closer to herd immunity with every day and every additional case of 19, and that does reduce the number of people vulnerable to infection. But the nation is likely still a long way off from reaching vaccination or prior infection for 70% of the population. Vanderbilt University infectious disease professor Dr. William Schaffner, not Shatner, said that while herd immunity likely is building in the U.S., contributing to the lower case numbers, it's too soon to predict that the nation will reach that point in the next 2 months. His thesis, I would raise it as a question. He raises it as a conclusion, said Dr. Schaffner. Fair enough. Not only does he draw a conclusion, he makes a prediction. It's Kind of dangerous. Trump did some things like that and he got roasted. Biden predicted schools would be open in his first 100 days. That prediction not really working out. You got to be careful with predictions, everybody. You know how it is. Both sides will look to get you if you promise something and you don't come through. U.S. daily confirmed CV increases. Cases and deaths. They were talking about cases around the 74,000 mark. You can see right here. Deaths would be the red line down here. It's hard to tell off of this graph. It looks like it's about midway through, maybe about, I don't know, they'll probably give us a specific number. I'm just trying to read the graph here. I sure hope he's correct, but I can't say that. I'd prefer to underpromise and overdeliver. And that's something I talked about in the past with Trump. He always would overpromise. And when the slightest bit of underdelivery happened, roasted. That's what you saw with Biden when he was talking about wanting to get 100 million vaccination shots out there in his first 100 days, when the U.S. was already doing those numbers in the final days of Trump. They were already delivering 1 million and on pace to do more than 1 million per day. So that's why they were saying to him before, hey, up those goals, buddy. But he was clearly trying to underpromise and then overdeliver and take the glory. Now, in government, yeah, I agree. You probably want to underpromise because you don't want to get people's hopes up. And I know everybody out there gets that. That's been the consistent prediction of public health officials like Dr. Fauci since vaccines were authorized by the FDA in December. By then, Dr. Fauci and others say that a share of Americans who have been vaccinated will approach 70%. So far, just 12.6% of the population has had one or more doses of the vaccine, and about 1.6 million doses are being given a day. At that rate, Bloomberg's vaccination calculator estimates that 70% of the U.S. won't be inoculated until about New Year's Day 2022. Lock it down, baby! 2 more years. Come on, I could do it. Some of that gap, however, will be made up by the number of Americans who acquire immunity by surviving the 19. As of Friday evening, 27.9 million cases of 19 have been confirmed, according to Johns Hopkins University data. It is widely agreed that that figure is an underestimate. The CDC estimates that some 83.1 million Americans have had the virus. And can you imagine how small that death rate is if that many people have really had it? Interesting. With a population of 331 million, that estimate would suggest that a quarter of the U.S. population has been infected, and immunity to 19, although it's still not clear how long that protection will last. Most studies suggest it will provide 3 to 8 months of immunity, at least. Combined with the 12.6% of the U.S. that's been infected, that would bring the total share of Americans with immunity to 37.6%. That doesn't make sense. The CDC estimates that 83.1 million have had the virus. I was thinking that therefore that meant a quarter would have been infected and had immunity. But they say combine that with the 12.6% that's been infected. You would think that that's worked into the 83.1 million, right? Come on, what kind of math are they doing here? Is this Cuomo that's putting these numbers out? Jesus. Even assuming both the CDC's estimate of cases and the vaccination rate are underestimates, the nation still is a long way off from herd immunity. If both vaccinations and infections both keep going up at current rates, it's possible that the combination could push the number of people with some immunity from one or the other past 300,000. But the declining case rates will hamper that progress, and variants, especially those that arrive to the U.S. from Brazil and South Africa, and can evade antibodies, could weaken protection if they take hold. I was listening to the news earlier here. We get stuck with LA news, and they were talking about, I shouldn't say they, some people in the medical profession were talking about the need for a third shot. I don't know how that would work out with all of this talk of new variants, South Africa, Brazil. How would that really be beneficial? I'm sure they'll come out with some science and tell me about it, but it would seem like as it mutates and we get these new variants, that the first 2 shots would be good for the past, and that these companies like Moderna and Pfizer need to be working continually and tweaking things to help people lengthen that period of time of immunity and to work against these new variants. Not a scientist at all, obviously, but it seems like, and they probably are, working behind the scenes in the lab to come up with vaccine 2.0. But Dr. Makary argues that the number of Americans who have already had the CV and are now immune, or at least less at risk of the infection, is discounted in other public health experts' predictions of when the U.S. could reach herd immunity. He also credits this for the current and precipitous decline in new infections. Why is the number of cases plummeting much faster than experts predicted, he asks? In large part because natural immunity from prior infection is far more common than can be measured by testing. Testing has been capturing only from 10% to 25% of infections, depending on when, during the pandemic, someone got the virus. So with the estimate above, the reported number of cases were approaching 28 million. The estimate was about 83. If you look at his numbers, he's estimating anywhere from, let me scroll down and let's see if they give us the numbers here. Daily vaccination rates. There's kind of a decline there recently. That may have had something to do with, let me look. That looks like when the winter storm came through. So I'd imagine that had something to do with that. This consistent rise kind of leveled off, then took a dive here. Probably had to do with that weather that killed a lot of the Midwest and Texas. Yeah, but if you look at his estimate there, if you take 28 million and he's saying anywhere from 10% to 25%, then he's saying anywhere from 100 million to 250 million would have immunity or in some form or fashion. Now, that's a huge gap, but let's see what we got here. Applying a time-weighted case capture, average of 1 in 6.5 to the cumulative 28 million confirmed cases would mean about 55% of Americans have natural immunity. Whew. So 55% then, so that 330 million in our population, 55% of that, what is that? About 170, 175, 180-ish. Don't have the calculator out in front of me. That's a lot of people. He writes that an additional 15% of Americans have been vaccinated this week. Data tracking from Bloomberg estimates that about 12.6% of the population has had 1 or more doses of the vaccine. So fact check, if those are correct, then good to have the accurate information, bringing the percent of people with immunity to nearly 70%, the lower end of community protection. It's hard to say how many people have actually had 19, not only because testing for 19 and antibodies is insufficient, but because no nationally representative studies on how many people have antibodies have been done since November, said Dr. Schaffner. What are we waiting for? Get on it! There have been millions of documented infections since then. Hundreds of thousands more likely went undetected, driving up the number of Americans with immunities. Deaths per day again, they show us this. You see here, this is last summer. We were in a decline, kind of like a little rocky, then started to shoot up here. What was that, about November, that looks like? Straight up here, and then it started to come down lately when the vaccination became more widespread, coupled with the number of cases, obviously, and immunity. Number of new infections per day, same kind of chart, rising, 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 and then that steep decline. Let's read some comments and wrap it up. So, when Biden assumed office, restaurants opened, and just like that, it begins to fall off the front pages. Herd immunity cost 500,000 citizens their lives in the U.S., and if you buy into this BS, you have a surprise coming, because it don't exist. I was going to ask what your specific expertise in the field of medicine is, but I saw your grammar. Woo! It's early Saturday morning. I needed that wake up. Reading these comments, I can see that the brainwash is really strong. Everyday people trashing a doctor on his medical opinion because it differs from what CNN told them. If this is true, well done, Donald. You want to risk your life or family members to find out? He's probably right, but we'll just have to wait and see. We don't have a long history with the 19, so the scientists and doctors are only taking a stab in the dark about his conclusions. It's still here! Yeah, says flying craft from Beverly Hills. As best I can tell from reading government sources, there is no rise in the US death rate for 2020. That is not aligned with the regular yearly increase. I went back 10 years, you can look it up. And I heard something about this in other videos and I didn't verify it for myself, so you can do what he says and verify this, but they did say that number, don't have that number, but the number of deaths that happen yearly in the US hasn't really seen a statistical change. So that makes you question why that is. What else is going on that is causing that? Could there be some factors that, with people being locked down due to this, the deaths due to other factors would be on the decline? I don't know. I'm just going to take a wild-ass guess right here and just say, well, what if people are working less and there's less work-related stress? I don't know. That's just something off the top of my head. But then again, anybody can counter and say, well, the stress of not having work, the stress of being in the home, right? Domestic violence cases are up, abuse is up, calls to 911 maybe up because of that too, money situations. So again, just throwing it out there. I'm sure that there's some other things that you're thinking about right now. It's like, well, why is this happening? Why are other factors of death likely going down if this is going up? And I'm Batman, so stop giving false hope when this virus is changing so much. The US will not gain herd immunity by April or ever. Get a hold of yourself, he says. How dare they publish this? The Dems want lockdown of the people forever. Fauci has now upped the ante to 99% of people vaccinated. 70, 80, 90. 5 masks and a plastic bag over the head. I bet Fauci would like that, and Cuomo probably would have liked that in the nursing homes as well. There is that ball game exception, though. Fauci got burned! Alright, everybody, that's all I got. Thoughts? Let me know. Your weekend. Have a good one. Take care, everybody. Get out. Get some fresh air, get some exercise, and be well.